Hello, Peterson Health family and Hill Country community. My name is Cory Edmondson, President and CEO of Peterson Health. I want to communicate with you about our success this past fiscal year. It may seem a little odd that I come to you at this time talking to you about our fiscal year, but our year runs from July to June. So we just wrapped up our 2019 year. It was a monumental year for us. First, I'd like to acknowledge my predecessor, Mr. Pat Murray. He announced his retirement in October of last year after serving this community and Peterson Health for 24 years. To name all of his accomplishments during this time would take hours. He hit many milestones during his career, namely this building and this beautiful campus. Just look around me. This hospital, the Callow Professional Office Building, our Ambulatory Care Center, and our recent building, the Home Care Hospice Building. Additionally, he established an employed physician model that is allowing us to provide care beyond all expectations. During his tenure, Peterson was named top 20 rural community hospitals, the only one in Texas. All of this has set the stage for our future. We are thankful for his community involvement and leadership statewide. He has now passed the baton to me. I have just completed my 90 days on the job. As I enter the hospital every day, I'm reminded of the incredible support of our donors. Behind me is the tribute to those donors who helped build this hospital. This same tribute is all over the campus, including the generous donations of our employees. What an incredible reminder of how our community is invested in this hospital and in healthcare. In my short tenure, I can say it's been exhaustingly great. The community has been graciously welcoming to me, and the Peterson family has been extraordinary. I have shared with the staff and the community this fact. You have a diamond in the Hill Country. If you haven't been to Peterson in the last 3 years, 12 months, or even yesterday, you really haven't experienced Peterson. We're on a trajectory going up and breaking records. I truly feel blessed to be working here, and I'm honored to work for such a fine organization. We are elevating health. Let me share with you a year in review. First, I want to celebrate our employees because they are going the extra mile. Our Employee of the Year is Julie Hutchinson. Our Nurse of the Year is Jolene Fudge. And our Leader Director of the Year is Tracy Davis. That's just an example of some of the employees who are doing some great things here. I also want to celebrate our volunteers. We couldn't do the things here without our volunteers. They do an absolutely wonderful job and smile at you every time you walk in. We also celebrated our 70th birthday. We celebrated with the community. They came, they flooded our buildings. They saw what kind of great things we were doing in this organization. It was a day of celebration on July 3rd. We won the 2019 Outstanding Patient Experience Award. That was 3 years running, and that really doesn't surprise me at all because we just finished our fiscal year with an overall hospital rating of 90%. That means that we are in the top 10% of hospitals throughout the country. That's exciting. The other thing is we are providing safe care. Hospitals are rated from a safety standpoint by an organization called Leapfrog. We got an A rating, just like a school, A to F, we got an A rating. We're also involved with the community. We hosted a summit this year that talked about our community needs and what the health disparities are. In fact, you can go to our website and see the Community Health Needs Assessment. We were able to strategize with community leaders and others to identify what we need to do with all the challenges that we face as a community for health care. Next, let me talk about our financial health. We talk about health as an individual and health as an organization. Our bottom line, we achieved a positive margin. What's even more positive is we beat last year's margin. But we have to do that in order to be able to handle charity care and some things that we do for the community. Charity care is those things that we do to help people out who can't afford the care. It's free care or reduced fees. We spent almost $15 million on charity care last year. We couldn't do that without a positive margin and the things that we do and the incredible staff we have. We also have bad debt that we have to account for of $29 million. That's those accounts that we can't get paid for. People don't pay us or for whatever case. Financial health is also about investing in our hospital and technology. We just rolled out a new electronic medical record to help integrate and take care of patients in a more comprehensive way. We also invested in a patient monitoring system to tunes of hundreds of thousands of dollars, and that is to help us take care of the patient technologically and provide advanced care and quick care and quality care. We also invested in patient beds that allow us to monitor the patient's weight. It also allows us to monitor whether they're a fall risk if they get out of bed, and they're longer for taller patients. And we also invested in mattresses to help redistribute weight. The other thing we've invested in is infant warmers. That's helped the patients that are born here to be more comfortable after birth. We also invested in high-end laboratory equipment that's not heard of in larger health institutions throughout the nation. Now I want to talk to you about our service line growth. These are areas of subspecialty that are important to us and important to the community. We heard your desires. We heard your needs. You told us you don't want to travel anywhere else but Kerrville for your care. So we invested in that. Let's start with cardiology. We invested in a brand new cath lab. We also invested in new equipment of our existing cath lab. So we now have 2 available for our community to access. We hired an interventional cardiologist, Dr. Waits, who allowed us to have better access for more cardiac patients. In fact, we increased our overall access by 37% for the total number of procedures done here at Peterson Health. Orthopedics. We have an award-winning orthopedics program. We now can do total knee surgeries the morning and send you home that night. General surgery cases are up. Our women's services area is up. In fact, we are delivering more babies than we did last year by 11%. The other need that we heard from the community is patient access. We added 9 new providers to Peterson Medical Associates. That includes cardiology, primary care, endocrinology, and others. With that, we were able to increase total access up 32% over last year. Another service line that we offer is home care and hospice. Those continue to increase as well. We're up 10% over last year as far as total number of visits and people calling for our assistance. And just recently, we opened Comfort Physical Therapy to provide services in that community. Woo! I've hit the ground running, but I'm running with winners. I look forward to sharing our successes with you in the near future.
Peterson Health. We're elevating health and each other. We are improving lives, inspiring others, raising families, lifting spirits. Here, now, for you.